Welcome to this overview of the evidence-based clinical model at Infinity Rehab, where we are setting the standard in post-acute rehabilitation. Our model begins with a systematic examination and evaluation process. That process is built on a foundation of the International Classification of Functioning Disability and Health, or the ICF. At Infinity, we use a core set of evidence-based outcome measures across the three primary domains of body structure and function, activity, and participation. By contrast, usual care is to measure only at the activity level. Our rich data set brings added information to the IDT related to clinically meaningful change and risk of adverse events. Our aggregated data helps us learn from our patients to see their similarities and differences, and then to tailor their care specific to their needs. Another way in which we are setting the standard is through our evidence-based interventions. We've culled the literature for large bodies of evidence that represent rehabilitation best practices for older adults. We've collated these practices and represented them here along these four pillars: intensity, patient self-management, prevention and wellness, and tailoring care to cognitive need. Our intensity and patient self-management pillars are particularly refined, so let's look at each in a bit more detail. In rehabilitation science, intensity refers to challenge, not time or amount of care. It's rather intuitive that in rehabilitation, we're going to ask patients to do more than they would do on their own. But what's new from the science is that for the activity to be truly effective, it needs to not just be somewhat harder than the patient's self-selected effort, but a lot harder. So let's look at two ways in which we use this intensity principle. The first way we measure intensity is through strength training, where the target intensity for older adults is 60 to 80% of the one repetition maximum. We start at 60% and move quickly to 80%, which is 8 to 10 repetitions to biomechanical failure. We also measure intensity of aerobic training. Unless there's a medical reason not to, our goal is to work in the moderate to vigorous heart rate training zone. These brief clips are demonstrations of individuals using tasks to reach these exercise targets, strength training on the top and aerobic training on the bottom. These high-intensity interventions are based on the leapfrog principle that comes from rehab science. We've traditionally thought we needed to use a stepwise progression of activity. This is usual care. Start relatively easily and gradually work to harder tasks. But the science says otherwise. The science says do the hard things right out of the gates, consistently and repeatedly, and the easier tasks will come along without specific attention to them. The evidence is so clear. Good things happen with high-intensity care as compared to usual care. We see decreased hospital admissions, fewer refusals, better balance, functional strength, walking speed, endurance, and overall active time. Our second pillar is the patient self-management pillar. These are evidence-based interventions designed to improve patient activation and engagement in their care and to build self-efficacy. This suite of interventions is rooted in motivational interviewing, and with them, we can guide patients to new behaviors that will help them reach their goals. We know these interventions work not only from the literature, but from our own studies as well. In this slide, the distance between the two red flags represents the change patients make in skilled nursing as reported in the literature. These are the gains from usual care. The first yellow flag represents the additional gains we made with our suite of patient self-management strategies, and the second yellow flag represents the gains made with high-intensity aerobic training. Yes, patients change with usual care, but look at what best evidence care can do. Look at all the additional life and protection from adverse events that patients get with best evidence care. That's what we're about at Infinity Rehab. The best of science with the art of caring, because usual care is not enough. Not enough to improve health, not enough to prevent hospitalization or decline, not enough to challenge top-tier clinicians, and not enough for you or the people you care about.